Good day and welcome to the dining room table. New York City Mayor Eric Adams is holding a press briefing for an update to the sad situation where babies overdosed at a daycare and one died. It is alleged to be fentanyl exposure. So, Mayor Adams has his Commissioner of Health, Dr. Vasan, who's going to go over the dangers of this drug. Uh, this is important to listen in. Please subscribe, like, and share.
I share the mayor's sentiments that Friday night and Saturday were the worst days of my time as health commissioner to date. I have 3 small children, 7, 10, 7, and 4. And watching the parents go through what they went through was one of the worst days I've experienced in this job or any job. And I've seen people die. I've accompanied people through their end of life in hospital settings. And this is where fentanyl belongs. I remember the first patient I gave fentanyl to, a woman in her 40s who had developed metastatic breast cancer, who herself was leaving a family behind and needed fentanyl to manage the pain of end-stage metastatic disease. I remember ordering it for the first time and realizing how powerful this substance is, but how much relief it gave to someone suffering from pain unimaginable to most of us. This is where fentanyl belongs. It doesn't belong on our streets, and it doesn't belong in our homes. It doesn't belong anywhere that trained clinicians are not. And it doesn't belong in forms like powders and aerosolized liquids. It belongs in syringes, and it belongs in hospitals where they are extremely controlled substances. Fentanyl is exquisitely dangerous. I use the word exquisitely because I don't have another word to describe how dangerous this drug is. And it is, in fact, completely stressing our entire response to the overdose crisis. People are dying who are dependent on fentanyl. People are dying who are casually using opioids and fentanyl. People are dying who are using non-opioids that are contaminated with fentanyl. We will soon release our overdose data for the city of New York, the calendar year 2022, and we will once again hit a record peak. Year on year, month on month, quarter on quarter, these numbers rise, and fentanyl has contributed to the acceleration of this crisis. As I said when I started as health commissioner, if it wasn't for COVID and then it's followed by Mpox and other infectious crises, this would be the number one issue. Now that we are no longer in the emergency, it should be our number one issue because it's taking too many lives too soon. A New Yorker dies of an overdose every 3 hours, and now it's going to be less than that. 80% of overdoses in New York City in 2021, and that's old data, involved fentanyl. That number is sure to rise. I cannot stress how dangerous this drug is in its synthetic form, its unexpected form. I also want to emphasize what the mayor said about Narcan. Narcan saved 3 babies' lives. We have defibrillators behind every bar, in every business, in every public event. Increasingly, we have epinephrine pens, EpiPens in public settings. Narcan has to be everywhere. You should be carrying Narcan right now. I have Narcan right here. These are the Narcan kits distributed by the city. Narcan is now available over the counter. You can go to your pharmacy and get Narcan. You can go to our website and see thousands of pharmacies where we distribute Narcan for free. You can call 311. We do free trainings. Each kit not only has 2 doses of Narcan to be administered through the nose, but has training and equipment for you to do so safely in the field. anytime you see someone walking past them who looks like they might not be conscious, who might not be breathing, who might look more sleepy or tired than usual, think overdose, think opioid intoxication, and think fentanyl.